The CDC is updating its guidance about how coronavirus is transmitted, suggesting it may not as easily spread in some of the ways we thought, while emphasizing another risk. Gabe Gutierrez reports.
Tonight, with global COVID-19 cases topping 5 million, the CDC has updated its guidance, now emphasizing that the coronavirus does not spread easily on contaminated surfaces. Reassurance for anyone who'd been diligently wiping down their packages and groceries.
What the CDC was trying to do is emphasize again how important close personal contact is. The surfaces certainly can be a source of the coronavirus, but it's a smaller road to transmission. It's that close personal contact which is really putting people at risk.
And with summer around the corner, the CDC also says there's no evidence the virus can be spread to people through the water in pools, hot tubs, or play areas. But Houston ER doctor Hillary Fairbrother says social distancing is still critical.
The key to prevention of large spikes of this virus or large increases or the second wave is social distancing, good hand hygiene, and wearing your mask when you're out in public.
Ahead of the Memorial Day weekend, the TSA is rolling out new safety measures at airports across the country, including telling passengers to take their paper boarding passes and place them directly on the readers instead of handing them to the TSA officers. The TSA is also now allowing 1 liquid hand sanitizer, up to 12 ounces, per passenger. And if a prohibited item is found in a carry-on during the X-ray, the traveler might be asked to leave the security area and remove it themselves. The battle plan against COVID-19 clearly is still a work in progress. Today we learned that researchers from the University of Washington found that at nursing homes, testing is more effective than screening for symptoms because some patients were asymptomatic. Last month, we first told you about Andrea Savagnis Gumbrell's 89-year-old father who suffered from dementia and underlying conditions at an assisted living facility in Massachusetts. Sadly, he's since passed away from coronavirus.
We were able to be by his side through a window, but we were so close to him. It was as though we were at his bedside.
Again, the CDC is emphasizing tonight that while it's possible to transfer the virus through surfaces, person-to-person transmission is much more likely, and social distancing is key. Lester?
All right, Gabe Gutierrez this evening. Thank you. In the race to develop a vaccine, a huge boost tonight from the U.S. government for an effort at Oxford that is showing promising initial results. Here's Keir Simmons.
Tonight, $1 billion from the U.S. government for a promising coronavirus vaccine. AstraZeneca says it could manufacture 1 billion doses worldwide by the end of 2021.
And this amount of money helps us to deliver 100 million doses to American citizens in October.
The team developing the vaccine at the UK's Oxford University telling NBC News they're stunned by so much support so quickly.
If you'd said that to me a month ago, that all of that would happen in a month, I'd have thought that was wild and fantastic. So, yeah, we're thrilled.
Human trials began in April with more than 1,000 participants. Some got the COVID-19 vaccine, a control group did not. Now, both groups' blood is being checked for antibodies to see if the vaccine has been effective. The results expected in 2 to 6 months.
And how hopeful are you of a positive result?
Well, we were hopeful a month ago. I don't think the probability of the vaccine working has changed at all in a month. Everything we've seen has been as expected.
Tests at Montana's Rocky Mountains lab on just 6 monkeys were positive. The vaccine stopped the virus from entering the lungs, though didn't prevent infection. President Trump has called for vaccines to be developed at warp speed. But some tonight warning moving too fast is dangerous.
You cannot afford not to do it right because so many lives are at stake.
Tonight, NBC News is told human trials will be expanding soon. AstraZeneca says it's preparing for 30,000 participants, including children. Lester?
The world anxiously watching for those results. All right, Keir Simmons, thanks. Tonight, with the entire country now easing restrictions, the virus is still exploding in some areas, especially parts of the South, one city running out of ICU beds. Here's Kerry Sanders.
In Alabama's coronavirus war room, disturbing news that ICU beds at hospitals in the state capital are full.
Right now, if you're from Montgomery and you need an ICU bed, you're in trouble.
Tonight, cases in Alabama continue to climb, now more than 13,000. Baptist Health System in Montgomery has 54 patients on ventilators. Doctors at the hospital at the University of Alabama Birmingham now on alert to take the overflow.
The virus is not gone. The virus is still out there. This is a smart virus that spreads very easily from person to person.
Montgomery and the rest of Alabama began reopening 10 days ago, and data from the policy lab at Children's Hospital at Philadelphia predicted it was a spot to watch. You're doing a prediction. It's not 100%, but do people accept what you're predicting?
Well, it's sort of like a weather forecast. I mean, we're projecting out 4 weeks, but it's helpful in guiding you what may happen over the next couple of weeks.
The newest Philadelphia model is now forecasting hotspots in Houston, Dallas, and across Tennessee. Another hotspot here in Florida with more than 48,000 coronavirus cases, with some beaches and restaurants now open and a busy Memorial Day weekend ahead, fears of a dangerous mix. Despite the urgency in Alabama's intensive care units, late today, Governor Kate Ivey announced the easing of even more restrictions starting tomorrow. Kerry Sanders, NBC News.
President Trump dealing with two disasters today in Michigan, declaring a federal emergency in the state after catastrophic flooding, and visiting a Ford plant now engaged in the battle against COVID-19. Kristen Welker has details.
President Trump in hard-hit Michigan, a state reeling from historic flooding and 5,000 deaths from COVID-19, touring a Ford plant that's now manufacturing ventilators.
You've made really America proud, and you've made Ford proud.
The president flouting the company's guidelines that require everyone to wear a mask, but said he did wear one during the private tour.
Here's my mask right here.
Ford says the executive chairman of the company, Bill Ford, encouraged the president to wear a mask. The president explained why he took it off, even as everyone around him kept theirs on.
I didn't want to give the press the pleasure of seeing it.
Earlier in the day, touting his negative test results.
I tested positively toward negative, right? So, no, I tested perfectly this morning, meaning I tested negative.
It's Mr. Trump's third visit to a critical battleground state in as many weeks. Aiming to energize his base, the president's been feuding with the state's Democratic governor, even threatening to withhold funding if Michigan attempts to expand mail-in voting, as many red and blue states are doing. It's a method he has said is prone to fraud without offering any evidence.
Voting by mail is wrought with fraud and abuse.
In fact, the president voted by mail in the Florida primary, and according to fact checkers, fraud from mail-in ballots is extremely rare. Earlier in the day, Michigan's governor hitting back.
Threatening to take money away from a state that is hurting as bad as we are right now is just scary.
Also tonight, the president's former personal lawyer, Michael Cohen, was released from federal prison to home confinement as authorities try to stem the spread of the virus among inmates. Lester.
All right, Kristen, thank you. Over 2 million more people applied for unemployment benefits last week. Job losses now surpassing 38 million, with those who work for small businesses hit especially hard. Here's Stephanie Rule.
Catherine Nguyen owns 3 toy stores in Chicago. Only 3 of her 12 employees are working.
I just love my business so much, and I want to do this forever. Not knowing how I'm going to be able to sustain the business keeps me up at night.
Her sales, now limited to curbside, have plummeted 80%.
Big online retailers like Amazon and large e-commerce sites are going to really pretty much take a lot of the revenue.
Many small brick and mortar stores are competing with the convenience and safety of shopping from home. This year, Amazon raked in more than $75 billion through March, a 26% jump compared to last year. Walmart's online sales skyrocketed 74%. While fewer people are headed to stores, those who do are buying more, driving up in-store sales at big box retailers. Walmart and Target made a combined $10 billion more than they did in the first 3 months of last year, both online and in-store. While a recent survey shows the majority of small businesses saw revenue drop more than 75%. Many are flocking to big retailers deemed essential.
We got spaghetti sauce, milk, bread.
In addition to toilet paper, water, food, and medication, many also sell toys, beauty products, jewelry, and sports equipment.
We're actually coming for badminton, like rackets.
The gray area of what's essential and what's non-essential is very blurred. So
Brian Farias' Jersey Shore Surf Shop is just a few miles from those big retailers.
we provide service that you can't get there, and that's why we've survived for 50 years.
For small businesses, if they don't reopen, what could happen?
It's going to be really sad. You know, you're going to be going to dinners at chain restaurants. You're going to be shopping at the Walmarts and Costco's permanently and not shopping at your mom and pop shops.
Small businesses trying to hold on, hoping to come out on the other side. Stephanie Rule, NBC News.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.